Afternoon, I am Dr. Wafaa lecturer of pediatrics in Mansoura Faculty of Medicine. Today our session will be about how to use meter dose inhaler. First, about meter dose inhaler, it's one of forms of drug administration in cases of bronchial asthma. This is what we call the meter dose inhaler. And to be familiar with this device, we should know its parts. First, it has what's called a cap. And when we open the cap, we have this opening, which is called the mouthpiece. And we have the container, which contains the drug. And usually the meter dose inhaler may be beta-2 agonist, like salbutamol, or long-acting beta-2 agonist, like salmeterol, or maybe inhaled corticosteroids with their different types. The meter dose inhaler can be used as it is, or can be used with other additive device like this device, which is called air chamber. And I want to show you the parts of the air chamber. It has a cap, and it has mouthpiece, and it has a rubbery end, and this rubbery end includes an opening at which we can introduce the meter dose inhaler, and we will show how to use them. And if we open this rubbery part, we can find here a white membrane inside, which is called the valve. And we will know during the demonstration the importance of this valve. And we can use the air chamber with the help of special face masks, and the mask is available with different sizes according to the age of the infant or children. After we have identified the equipment, we are going to explain how to use them. First, this is how to hold the meter dose inhaler. It should be holding like this. Then you will go to open the cap, and you should look at the mouthpiece. If there is any particles or precipitate, you should clean them before using the MDI. Then you should shake it 3 to 5 times to mix the ingredients inside. Then you are going to compress the container to try it. And this is called priming. And of course, you don't need priming except if you haven't used it for a while. After that, you will ask the patient to exhale fully, like this. Then he is going to put the mouthpiece inside the mouth by the teeth, and he will close the lips tightly, and he will receive his puff. Then take a slow and deep breath. Then will hold his breath for 10 seconds to give time for the drug to reach the airways, and after that he can take his breath. Now I'm going to show it on myself. And now I received my puff. If the doctor prescribed another dose for me, so I should receive 2 puffs, I won't take the next puff until after passage of 1 minute. This is how to use the MDI directly. If you revised the literature and the guidelines from the thoracic societies, you will find that using the MDI directly to receive the dose will only give you about 20% of the dose. So it's advised not to use the MDI directly, but to use it using the air chamber. And what's the idea behind the air chamber? The idea behind the air chamber, it will give time to the particles of the drug to be reserved here. So the air chamber will act as a reservoir, giving more time for the particles of the drug to reach the airway. So this will ensure higher dose and better efficacy and better control of the asthma symptom. I will show you how to put the MDI inside the air chamber. First, you are going to open the cap of the air chamber. Then you are going to put the MDI at the rotary opening at the end of the air chamber. And to use it, it's exactly like what we have explained in the MDI. You are going to shake it 3 to 5 times. Then the patient will exhale fully. Then he will put the mouthpiece of the air chamber inside his mouth, between his teeth, and clench tightly by his lips. Then he will receive the dose and have a slow and deep breathing. Then hold his breathing for 10 seconds. And after that, the dose is delivered. I will show you what's the function of the valve here. The valve will ensure that you are doing breathing in appropriate way, which is slow and deep. Because if you are taking rapid and fast breathing, it will give a voice. Like I will show you now the voice. So I shouldn't have sound. Till now we can use the MDI with the air chamber with cooperative child or adolescent who can follow our orders after explanation well. But sometimes we have young infant and they move and can't close their mouth on the mouthpiece. So at that time we may need the help of the face mask. We will put it here at the side of the mouthpiece, and let's imagine this is a nice infant who is 6 months. You should know that during receiving the MDI, the patient should be standing or sitting. I can't give the MDI in recumbent position. So I will keep him sitting like that, and I will coapt the face mask on his face. Then I will give him the dose. So this is the use of the face mask. And now we have explained how to use MDI alone, how to use MDI with the air chamber, which is the gold standard, and how to use the MDI, the air chamber, and the face mask for young infant. And now, after we finish giving the dose, we should know how to keep our drug. I will take the MDI off. I will cover it again with the cap to keep the drug constant inside the container. Then I will remove the face mask and I will open the air chamber and wash them. How we are going to wash them? Just you have to bring some water and soap and you put them for a few minutes inside the water and the soap. But please don't try to rub it from inside or outside, because the air chamber is formed of a special material which is repellent. It prevents the precipitation of drug particles on its sides. But if you rubbed it using towels or any washing material, this will lead that this air chamber will lose its function as reservoir. And of course, you don't have to clean it with every time, but at least once per week. The last notice I want to tell it for you: if the MDI contain inhaled corticosteroid, after receiving your dose, you should wash your mouth and your teeth to avoid fungal infection. This is what we explained today, how to use the metered dose inhaler or the MDI. For more information, I will leave you a link for other educational videos. You will find it on the website.